Good evening. This is Nadia Naif with Red County, and I have with me this evening Dr. David Yarian, the former medical director of Solantic, the chain of urgent care clinics that is still owned by Republican candidate for governor Rick Scott. Good evening, Dr. Yarian. Thank you for joining us here on Red County.
Good evening.
I wanted to ask you a few questions about your experience working with Rick Scott. I sat down with Rick Scott for about an hour, about a month ago, and he came off as a very kind and sincere and even humble man. Now, I've read some and spoken to you about your experience working with him. What was it like on a day-to-day basis working for Rick Scott?
Well, initially he came across the same way with me as a kind and humble man, but as I began working with him and having almost daily encounters with him either by phone or in person or by email, it became very apparent to me that he had some very strange notions and preconceptions about individuals. One of my first...
What kind of strange notions and conceptions about?
He would send me emails, and he'd like to talk about the type of people he would want to be employed and working for Solantic. And in one of his emails, he said people working for Solantic have to be fit, trim, and attractive.
Okay. Is that what you meant when you said mainstream?
No, that situation came up later. The first encounter I had where I felt that he was discriminating against very qualified employees that I was requesting clearance to hire was a female candidate that I interviewed to be a individual to help work alongside myself to help manage the clinics. Mm-hmm. And she had a very good background, had a good resume, was very qualified, and I placed a phone call to him to discuss her qualifications. He was very satisfied when I reviewed her qualifications and her past experience, and before he would give me the okay to move further, he asked me, well, describe her to me. What did she look like? And as I described her to him, I said she has a little bit of a weight problem, and he immediately cut me off and said, fat people can't work for us.
Okay. Now, Mr. Scott has described himself as an investor in Solantic. Now, you argue that he was actually running the company. Is that correct? And making the hiring decisions,
yes,
the marketing decisions, even the company logo. He was involved in that. Is that correct?
He used that argument to get out of and avoid being depoted and answer questions under oath when I had filed a suit against him. He signed an employment agreement with me identifying himself as the CEO of Solantic. My employment agreement had his signature on it and identified him as CEO.
And not Karen Bowling.
And not Karen Bowling. And he met regularly with staff members on a regular basis, making decisions about the company. He was involved in all aspects of decision making. After I filed suit against him, he claimed that the signature on his employment agreement with me was a clerical error. A clerical error, he claimed, and that he was only an investor. And as an attorney, he knew that as just being an investor and not being the CEO, he could not be held responsible for any of the practices in terms of hiring, firing, and things like that. So he actually used that disguise that it was a clerical error so he could avoid having to answer questions under oath with regards to statements that he had said and actions he had taken against them.
So, Dr. Yarian, how is Rick Scott perceived in the medical community?
It's my experience that the overwhelming majority of doctors and healthcare professionals that worked in Columbia HCA hospitals and were impacted by decisions and policies instituted by Rick Scott have a tremendous dislike for him and actually are angry about how he benefited from the misfortune of those hospitals and walked away with a large sum of money.
How were the patients treated at those hospitals, and what type of demands were put on the physicians treating those patients as far as revenue?
With Rick Scott, everything was a numbers game. You had the numbers is what counted. You had to see more and more patients and shorter periods of time. So everything was judged by, okay, how quickly you can get them in and out.
So patients coming into Columbia HCA weren't seen as patients, they were seen as a billing event.
That's correct. They were billing events and an ability to generate revenue. And I would welcome anyone to contact doctors, healthcare professionals who had the experience of working for Rick Scott in that setting and get their opinion. It would be very interesting to see what their opinion is.
So the level of care actually, it was a lower level of care. They didn't have the quality of care that Mr. Scott has said. One of the things he says is that he's always worked to have the best patient outcomes, but it doesn't sound like that was actually the case. It sounds like the highest possible revenue outcome.
That's right. And you know, you can do a lot with statistics. And just looking at the statistics doesn't always tell the real story. And in my opinion, they didn't have the highest outcomes or the best outcomes. Things were just manipulated statistically, and that happens all the time. You can get statistics to say what you want them to say.
The physician, Karen Bowling, said that one of the reasons that you were let go was because of taking some pharmaceutical samples, but she also mentioned that you were let go because you had repeatedly complained that Rick Scott was refusing to consider well-qualified applicants because they spoke with a Hispanic accent or because they were overweight. Is that true?
Yes, I complained, but I wouldn't say that it was repeatedly, because the time frame from when the first time I actually raised my concern, it was directly in those terms was when I sent an email to Rick Scott, because during a staff meeting that Rick Scott was at, there was a comment made that our people working for Solantic had to be mainstream. And as I began to think about that and other discussions that we had comments that he had made, I was very concerned about the potential for that to be discriminatory. So I sent him an email asking him, first I told him I felt this could be discriminatory, and I wanted to know what he meant by mainstream. And the next day after I sent that email, I was told by Karen Bowling to no longer contact him, have no phone conversations with him. And prior to that time, the majority of the communication was initiated by Rick calling me and sending me emails, and weren't initiated by myself. And I was told I could not contact him, and I was also told if I couldn't change my attitude, I had no future with the company.